here are some of the things that are grounded in science. Oxidative stress is seen in every psychiatric disorder. ADHD, autism, depression, bipolar, schizophrenia. It's not necessarily seen with axis 2, what used to be called axis 2 disorders, but it is seen with biological conditions like schizophrenia. Okay. So there are several things that can be used to address oxidative stress. One is antioxidants, actual supplements for antioxidants. There's one called an ACEs supplement. It's vitamin A, C, E, and selenium. And it's kind of like a nice little potent antioxidant cocktail right there in a pill. Obviously, the total holistic solution is not take this pill and that's going to be it. Eating well is appropriate, and nutrition is very important for people with schizophrenia, particularly those that are battling the metabolic issues and the weight gain. So lots of fruits and vegetables, that'll deal with the antioxidants, and then lots of lean protein, and try to avoid the carbs. So that would address on a dietary component the oxidative stress, and then supplements. There is this interesting supplement called N-acetylcysteine. NAC. And I first saw it in the literature as helpful for nail biting and picking. But in schizophrenia, 90 papers published in the peer-reviewed literature as of this morning looking at N-acetylcysteine schizophrenia. Wow. The most recent one was published as recently as 2 months ago, March, and it looked at using high-dose N-acetylcysteine, not the usual 500 milligram 2 or 3 times a day type dose, but in this study, 3,200 milligrams of N-acetylcysteine per day, and looking at how patients did with the PANS, P-A-N-N-S, which is one of the symptoms, positive and negative symptoms of schizophrenia, how they did with that. And there was a remarkable improvement on the PANS for the patients with schizophrenia that had the N-acetylcysteine used.
And NAC is worth a shot if you have schizophrenia.
I think it is. That and antioxidants, vitamin D is published in terms of use with patients with schizophrenia, and also the omega-3 fatty acids.
Fish oil.
Fish oil. So those are some things. And then you and I were talking about food allergies. Some of the big ones are gluten, dairy, and soy, and also eggs. Those I have seen a lot. And the interesting thing about this type of IgG food sensitivity, Bethany, is that it's not an immediate reaction. So you can eat it, and it's like, not feeling anything.
Happened.
Yeah, nothing happened. But then the reaction can occur anywhere from hours out to about 3 days, 72 hours after you eat it. And the problem is, it's like a hit and run situation. By the time the victim is found on the side of the road, the driver that did it is long gone.
Yeah.
So, and then the other problem with this, so it's very difficult to correlate cause and effect. Like, okay, I'm feeling woozy. I'm feeling cloudy in my head. I have a headache. I have a bellyache. I have constipation. Whatever. I have an exacerbation of my schizophrenia. Okay. It's difficult to correlate that because it can come anywhere out to 3 days after you eat the food. So there are a couple of ways to deal with this. And gluten sensitivity, I'm going to come back to where we started on this. Gluten sensitivity and schizophrenia is published. So if you type, and I'm going to present some things about that at University of Cincinnati coming up later this month. Yes. But if you type in gluten, schizophrenia, you will find an extraordinary amount of literature. So there are a couple of ways, Bethany, that I look at holistically integrating this with patients. One is if they are on a reasonable medication combination and the patient isn't better, then look at some of the holistic things that can be done. Vitamin D, N-acetylcysteine, fish oil, and gluten and dairy sensitivity. See if there's something there. And then if the patient isn't better, then or definitively better, then it's time to look farther downfield in terms of classic allopathic medicines.
Never give up.